Welcome to the Ultimate Dentist podcast. Join us to hear success stories of various individuals and learn clinical and life hacks to help you become the ultimate dentist. Hey everyone, I hope you are all doing great. In this episode, I would like to discuss about treatment planning of supra erupted tooth. Now, this tooth may have supra erupted for multiple reasons. It could be that there is a crowding and there is the lower tooth. Let's say if for this episode we are going to discuss, let's say upper right six, which is supra erupted. Now, upper right six, let's say many reason could be supra erupted. Lower right tooth, because lower right, let's say five is missing, and the tooth has tipped lower right tooth mesially, lower right six, and that's why the upper right six has supra erupted. Or let's say lower right six has got a worn down restoration, and because of that upper right six has supra erupted. Or lower right six is completely missing, and because of that upper right six is supra erupted. So these are the three scenarios we are going to look into, how you are going to manage, or how I manage these cases. There are multiple ways to manage, and you can pick and choose the way you like. But let's say first scenario where lower right six has lower right five, let's say, is missing, and lower right six has tipped mesially forward, and upper right six has supra erupted. Now, in this case, if the lower right six is nice and it's healthy, it may be worth considering orthodontic treatment to upright lower right six, intrude right six, intrude, and then restore lower right five with some sort of a fixed appliance, mainly ideally implant. And that would be really good option. Now, orthodontic intrusion can be done in scenario 2 as well, where there is a worn down restoration, or scenario 3 where his opposing tooth is missing as well. So orthodontic intrusion ideally is the best way, because if the tooth is moved, we want to put the tooth back where it should be. And one of the way to do that is doing orthodontic treatment. Now, orthodontic treatment doesn't mean fixed braces or sectional braces, or any type of orthodontic appliance only. It could be that you may restore, let's say, lower right six if there is if it's present, and leave it supra occluded, in the sense that it's only occluding with upper right six, and maybe intrude upper right six in that way. However, you need to be a bit careful. If the lower right six is badly broken, then it can cause an issue with that tooth. But I have seen cases where people have done lower right six cuspal coverage using metal restoration, and then almost like a dial technique, and you're dialing upper right six where it should be. Um, and the other option is, let's say if lower right six is missing and upper right six is supra erupted, then you can create a Maryland bridge, which is just literally bonded on to lower right seven and lower right five, which is high in occlusion with the upper right six, and then you can intrude upper right six in that manner. So this is one way to do, which is orthodontic movement, either leaving the by orthodontic treatment, or by either leaving the restoration high. Now, the other option you have, let's say lower right six has got worn down restoration, and this is something very easy to get caught up with, where you see a worn down restoration, you tell patient this restoration is changing, you restore the tooth with the new restoration, really nicely sculpted tooth. But then what happens is that you start checking occlusion, and then you have to reduce more and more and more tooth. In this scenario, it is very important that you discuss this with patient before you touch the tooth. Before you do anything to the tooth, you tell patient that the upper right six is supra erupted, and we may have to deal with that tooth. One of the way to do that is, if you're not doing orthodontic treatment, is to do selective enameloplasty, which means you grind the tooth a little bit in order to create space for your restoration for lower right six in a natural shape and form. So that's one of, however, if you do that selective grinding, but you do that after you've done the lower right six filling, then patient will not appreciate that. So you need to have a discussion with patient before you are going to do anything to the tooth. So the first option was orthodontic treatment or intrusion. either doing fixed braces or dial appliance, and the second option is doing selective grinding of the tooth. Now, if you're doing that, make sure that if you've done enameloplasty, then make sure that you always on patient of sensitivity, and in worst case scenario, root canal treatment. Now, of course, if you're doing just enameloplasty, then that's not going to happen. But if you're going to hack the tooth down really badly, then sometime patient may need a root canal treatment, and this could be your treatment of choice. You may say, look, there is no other option but for us to chop the tooth down so much that we are going to expose the nerve, and that means we need to intentionally do the root canal treatment, and which is again a valid option. If you consider everything else and it's not possible, then you can really remove a lot of tooth tissue and then possibly do a root canal and just restore the tooth with some composite. Now, this is possible. This is necessary sometime where patient has complete collapsed bite, and you can't really increase OVD too much in order to do anything with that tooth, because there is no anchorage. Maybe orthodontist cannot do any orthodontic movement. There is no opposing tooth for you to do dial. So you are left with two choices, really: either to take that tooth out, which is a very drastic option, which is still an option, or remove the tooth tissue a lot in order to create space for restoration. That leads us to another option, which is removal of the tooth. If the tooth is really badly supra erupted, then sometime there is no other option but to extract the tooth in order for you to do full mouth reconstruction, because there is no way sometime you can do anything with these teeth. So even if the tooth is firm, you may have to end up removing the tooth, which is not very common, but that is an option where you may have to remove the tooth in order to create that space or create the harmony in your occlusal plane. You don't want very uneven occlusal plane. Now, one option which I haven't mentioned is, again, if let's say upper right 6 is supra erupted, but it's very heavily restored, and you want to restore lower right 6, which is missing with, let's say, dental implant, or lower right 6, which has got worn down restoration, and you want to restore that tooth, it may make sense to then upper right 6, because it's heavily restored, to do cuspal coverage. And when you do cuspal coverage, you do a little bit more reduction than normal, so that your final restoration is going to be in this good occlusal plane or level of the plane. So if you, let's say, tooth is supra erupted by 2 millimeter, hypothetically, then if your onlay needs, let's say, 1.5 millimeter thickness reduction, you're going to do 3.5 millimeter reduction, so that your overall reducing 3.5 millimeter, but your final onlay will be 1.5 millimeter. So you're gaining 2 millimeter of the space. So you prepare more. However, you have to be very careful, and you need to warn patient that this could lead to patient needing root canal treatment. But again, if you want to restore that lower implant or lower restoration in a nice occlusal plane, then you may have to do that, and that may be a compromise patient is willing to pay, or you are willing to pay for that compromise, in the sense that doing a treatment of the opposing tooth. So these are the options you need to keep in mind when you are doing restoration. One of the main time where we get caught up by is those scenario where lower right 6 is heavily restored and you're changing the restoration, but you haven't considered that upper right 6 may have supra erupted, and we still call it like a plunger cusp effect, but that is really a supra eruption of the opposing tooth into that cavity. So I hope that makes sense, and I hope you enjoyed this episode. As I said, ideally your aim should be to do orthodontic movement first, and that's the best way to do that. More and more full mouth reconstruction you do, you would realize that how many times teeth are just not there in the right position. If they are there in the right position, then your life will become much more easy. So always ask yourself a question: is this tooth in the right position? And if it's not, see if you can do orthodontic treatment to move that tooth into right position, and that's the best thing to do. However, it's not always possible, so keep the selective grinding method, or cuspal coverage method, or um, even drastic reduction of the tooth and root canal or extraction, options open, so that you can consider all the options and discuss with patient. Many time there is no right or wrong. You just need to discuss with the patient and come up with a solution which is mutually beneficial, which is beneficial to patient, but mutually agreed with you and between you and patient. So again, I hope you enjoyed this episode, and I will see you in the next episode.